Hi, welcome back to Medi Angel's Career Solution. This is Krishna Priya here with another role play. In today's cue card, we will be talking to a 45-year-old woman who is admitted with a suspected stroke. The doctor has asked you to administer a Warfarin injection for the patient. Here, you will have the task of getting her medical history and also explaining how she needs to take the Warfarin in the form of tablet every day for the next 4 weeks. You need to clarify her doubts regarding the same and warn her to inform us regarding any unusual or prolonged bleeding. Let's make sure we are taking notes now after the scenario.
Good morning.
Good morning.
My name is Anila. I'm one of the registered nurses working in this ward today. What would you prefer to be called?
You can call me Richa.
Okay, Richa. I'm here to give you your medication. Is that okay?
Yeah, that's fine.
Okay. So, doctor has prescribed Warfarin. It's an anticoagulant used for thinning of blood. And have you heard of this medication before?
Yes, I think so because my father used to take Warfarin tablets, so I think I know them.
Okay, so as I mentioned to you, it is used for thinning of blood and it is normally taken orally, but in your case the initial dose is an injection to get it working more quickly. So before I can give the injection, may I ask you some questions?
Yeah, sure, you can.
Alright, so do you have any ongoing medical conditions like hypertension or diabetes?
I don't have anything that you mentioned, but I suffer from polycystic ovarian syndrome.
Okay, so do you take any medication for that?
Yeah, I take herbal supplements for that.
Alright, so are you on any other medication at the moment?
No, I'm not.
Okay, so are you allergic to any medications?
As far as I know, I'm not allergic to any medication.
Okay, so would you mind telling me if you smoke?
No, I don't.
Okay, so what about your alcohol consumption?
No, I don't take any alcohol.
Alright, so thank you for answering my questions. And from our discussion, I've come to know that you are having polycystic ovarian syndrome, for which you are on some herbal supplements, right?
That's right.
Alright, so now I'm going to give you the injection, following which you will need to take it in tablet form on an everyday basis for the next 4 weeks. Is it okay?
Okay.
Alright, so also I need to check it with the doctor whether you can continue your herbal supplements.
Oh, so I need to stop taking my herbal supplements?
Yes, like Warfarin can cause some problems if it taken with some herbal supplements because it can interfere with the Warfarin action and can cause some side effects. So it is imperative that we need to take the doctor's consent in this matter.
Okay.
Alright, so moreover I need to there are some things you need to be mindful of while you are on these medicines. May I explain that?
Yeah, sure, please.
Okay, so firstly you need to take this medicine at the same time each day. So are you able to do that?
Yeah, sure, I'll do that.
Alright, so the next thing is to not take any over-the-counter medications without the doctor's prescription. Like I mentioned, it can cause some side effects. So, and the last thing is that you need to minimize the intake of foods rich in vitamin K, which can make the Warfarin less effective.
Okay.
So do you have any other questions so far?
Yeah, so vitamin K foods, can you please tell me a few examples?
Okay, so there are some foods like some green leafy vegetables like spinach and cauliflower. There can cause some problems with this Warfarin, so you need to avoid these foods. For the further understanding, I will give you a patient information leaflet with detailed information regarding how to manage your diet while you are on Warfarin.
Oh yeah, that will be helpful.
Okay, nice. So is there anything that you would like to ask me?
Yeah, sure. So I told you that my father used to take Warfarin tablets, right? So when you told me that I need to take Warfarin tablets after the injection, I'm a bit concerned because while my father was taking this tablet, he used to get nasal bleeding. So I'm just worried. Well, is that a side effect? Is a common side effect?
Well, I can understand why you have this concern, but don't get worried. And I will explain why your dad gets this nosebleeds with this warfarin. And let me explain. Some people may experience some side effects like slight nosebleeds or some gum bleeding, and it happens only occasionally. And I'm glad to tell you that this warfarin is generally tolerable by patients, and it's not as dangerous as you think if you follow the instructions outlined in the patient information leaflet. So how does that sound?
Okay, yeah, that sounds safe.
And one more thing is that if you notice any symptoms like unusual bleeding or heavy bleeding, you can come to the hospital immediately and we will provide some measures to relieve it. Is it okay?
Yeah, that
All
sounds
right.
like a good plan.
Okay. So is there anything else that you would like to ask me?
No, that's it. You've been really clear to me. Yeah.
Yes, thank you. And I hope I was able to address your concerns. And now I'm going to administer the medication. After that, I will be here shortly with the patient information leaflet, and you can press the buzzer if you need anything else. Okay?
Yeah, sure, definitely.
Okay, so thank you very much for your time and patience, and get well soon.
Thank you. Bye.